Masks. Probably the most controversial issue related to the COVID pandemic. Yeah, there are those vaccines too. Now, Dr. Anthony Fauci and other health officials are expressing concern about people not masking up as the number of COVID cases and hospitalizations are rising. Now, what does that mean for everybody? Let's talk about it. Hey, everybody, it's Dr. David. So, gosh, it would be nice to not have to talk about this stuff anymore. I know Dr. Anthony Fauci, he's obviously no longer official part of the government, but he certainly is, at least in many circles, considered a respected scientist, physician, and infectious disease specialist. I know I've talked before that his experience goes way before COVID with the HIV, lots of other things that he's worked on before, and he has done some pretty remarkable work over the course of his career. I realize that he has become the scapegoat for some people, and certainly throughout the course of the pandemic, he made comments that in hindsight that turned out to not be so accurate. Although I do have to say in all honesty that I think that, Dr. Fauci and all of his and other officials were doing the best that they can with limited amount of knowledge in a rapidly changing situation where people were dying. Okay, so certainly even when he was talking, originally I know they mentioned about, saving masks for the doctors, and all of a sudden they went to wearing masks for everybody, to the right type of masks and everything like that. So we're going to kind of get into that a little bit, but still I realize that this is a sore subject for some people, but I did want to talk about it because it is in the news. Okay, so we haven't discussed this for a while, but it is interesting because here in Florida, I'm not sure if you're aware that in terms of the current law, so this past legislative session that happened in the spring, and therefore effective as of June 1st, the Florida law now says that no business or education, like a school or government entity, is allowed to demand masks be worn to be inside. Okay. Now, there is an exception for that in terms of inside medical clinics, hospitals, etc., laboratories, etc., like that. But overall, no one can force it on somebody anywhere. And of course, you can have your opinions on that as well. All right. Now, in terms of the national guidelines, okay, so at this moment, the only strong guideline and recommendation when it comes to wearing masks is if a person tests positive for COVID. Remember, they're supposed to be in quarantine for the first 5 days. That's when they're the most contagious. Okay, 5 days from the start of symptoms, even if the test shows positive afterwards. But days 5 through 10 afterwards, unless there are 2 negative COVID tests after those 5 days, one is supposed to, if they're out in public, wear a mask for those second 5 days for up to day 10. I think that this makes sense, okay? Because I'm not convinced how much of that masks are going to be in preventing a person from catching something. But there is no doubt in my mind that if a person's breathing into a mask with fibers that catch it, yeah, that's not to say that something can't escape from the sides, but most of it is going to get caught. So I do think that there is relevancy to a positive person, to a person who was positive of doing it, because they may still be contagious even though they're not as contagious as during those first 5 days. Okay. Now, in terms of the new wording that's coming out, and all public healthcare officials are using much softer language than what we were seeing during the pandemic. They're saying they're recommending, they're using the word suggesting. They're not making those strong words and making it seem as if people who aren't wearing masks, and again, I'm not talking about during those 5 days, it certainly seems as if people were being scorned for a while. Same thing we saw with people who chose not to vaccinate. But we're not hearing that kind of language that's coming out. There's definitely been a softening. But Dr. Fauci himself said, and I'm going to get this right, that people should consider using masks once again, particularly if local health officials recommend it as a way of suppressing transmission of the virus. Okay, now we're going to get into what that all means too. But that's what his wording was. But you'll notice that's not a very strong statement compared to stuff that he said in the past, right? So, times change. We are in an endemic situation. We're not in a pandemic anymore. Okay, now, are there benefits to wearing masks in the first place? Now, I've discussed in the past that there is, certainly the quality of the mask. We've talked about N95, KN95 versus a gaiter or even a surgical mask might have some differences, although I've talked about some data that shows that this may not be so after all. But as I said, I do think that there's more benefit to a person who was positive wearing a mask for that time period. And again, do I understand a lot of people who, especially if they're high risk or if they have family members that they're wearing a mask, will that protect them? The evidence is very mixed on that, and we'll talk about that. So, in terms of the research itself, okay, so I've talked before about the Cochrane reviews, which are meta analyses. And this means that there's a whole bunch of studies that are looked at by this organization. Some of the studies are rejected because they're poor quality or other things. Didn't go through a proper institutional review board. There could be reasons why a study would be rejected. Okay. And then amongst that, they then decide on the high quality studies, and then they do statistical changes and analyses in order to try to make them be as similar as possible. Because every study is done differently. How what are the, we've talked in the past of, what's the difference? There's a difference between a person having COVID or being sick from COVID as opposed to just having it along, in hospital. When people get hospitalized in the past, people were, tested universally, and if they tested positive, even if they were there for a broken leg, it still got written on the chart that they had it and it counted in the numbers. Now, most of the time, hospitals and medical clinics are not universally screening for people. They're only checking for people who have symptoms that are consistent with the potential of having COVID. So there's obviously some differences there in terms of just the amount of data and the way it was collected, because you're going to find people asymptomatic if you swab everybody that you would not find if you were just checking for people who potentially were showing symptoms. Okay. Now, in this Cochrane meta-analysis that came out, they actually showed that when looking at all of these studies put together, that wearing the medical surgical masks, like they're usually the blue ones, but I've seen some other colors as well, the ones that go around but that are worn in like surgical suites that most people have used, they actually found that in the community itself, that it probably made little to no difference whatsoever if just wearing a mask in terms of protecting yourself. Okay. And they compared that to people who didn't wear masks at all, and they didn't see a difference. Okay. Now, they also showed that they said it was weak evidence. There was some evidence, but it was weak, that the N95 type of mask really didn't make that much of a difference too. Now, of course, how a person wears a mask, how much they cover up in terms of spaces, N95s more so, but there can still be wearing it wrong. We still see people who've worn masks like this. So, of course, wearing it properly does have some level of effect. And, they would often ask people how often do you wear a mask? But they didn't say, hey, can you put it on and show me how you do it? So again, there could be some skewing of the data there as well. Okay. Now, Tom Jefferson, no relationship that I'm aware of to the president. He's from Oxford University. He's an epidemiologist, and he's the one who led this particular Cochrane review. And he said in an interview the following: there's no evidence that masks are effective during a pandemic. That's pretty strong wording from a doctor. And he then wanted to say it makes no difference. None of it. There is just no evidence that masks make any difference. Full stop. Wow. That's pretty strong stuff there, right? Now, the actual paper itself did make this following statement, so I do want to quote that because, again, usually things aren't quite so cut and dry. The high risk of bias in the trials, variation in outcome measurement, and relatively low adherence with the interventions during these studies hampered drawing firm conclusions. Of course, as less and less people wore masks as the pandemic and into the endemic phase, of course, it's more difficult to collect data, but especially to compare it to the data from 2 years ago when people may have been more likely wearing the masks. Okay. Interestingly, though, in this Cochrane review, there was something that did make a difference: hand washing. It wasn't tremendous, but it was a 14% statistical improvement. And statistically, it was improved that people who did wash hands did have a less likely chance of catching it and passing it along. So, that's probably a non-controversial thing. We should all be washing our hands all the time anyway. And certainly there was a big push for that at the beginning, and certainly washing hands is still a good idea. Okay. Now, I do want to point out that there were other studies during the pandemic that clearly did show that masks did make a benefit. So again, that was at different parts and it's in now. And obviously we're talking about these new Omicron variants that keep popping up that continue to be more contagious, even though seemingly less dangerous, right? But the more contagious something is, that means the fewer viral particles that a person needs to inhale or to get into their nose in order to cause symptoms, right? So may not much less maybe getting through, but still causing symptoms. Okay. So in terms of my takeaway, if you are positive for COVID, if you have to go out during those second 5 days, I think it's a good idea to wear a good quality mask. Okay, but of course, if you have high risk people in your family, of course, be more cautious for yourself. To me, that's just common sense. Okay, but of course, take your vitamin D and zinc, check your levels, make sure you have them optimized in the middle part of range. That seems to make a huge difference, as we've talked about, and as my mantra is. All right, have a nice day.